Occasional anxiety is a normal part of life. You might feel anxious when faced with a problem at work, before taking a test, or making an important decision. But anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. The feelings can interfere with daily activities such as job performance, schoolwork, and relationships. According to the U.S. Department of Health and Human Services, there are 5 different types of anxiety disorders: generalized anxiety disorder, panic disorder, social anxiety disorder, obsessive-compulsive disorder, or OCD, and phobias, each of which will be explained in this module. People with generalized anxiety disorder display excessive anxiety or worry for months and experience several anxiety-related symptoms. These symptoms may include restlessness or feeling wound up or on edge, being easily fatigued, difficulty concentrating or experiencing the mind going blank, irritability, muscle tension, difficulty controlling worry, and sleep problems, such as difficulty falling or staying asleep, or restless, unsatisfying sleep. People with panic disorder have recurrent, unexpected panic attacks. Panic attacks are sudden periods of intense fear that may include palpitations, pounding heart, or accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath, smothering or choking, and a feeling of impending doom. Panic disorder symptoms include sudden and repeated attacks of intense fear, feelings of being out of control during a panic attack, intense worries about when the next attack will happen, and fear or avoidance of places where panic attacks have occurred in the past. People with social anxiety disorder, sometimes called social phobia, have a marked fear of social or performance situations in which they expect to feel embarrassed, judged, rejected, or fearful of offending others. Social anxiety disorder symptoms include feeling highly anxious about being with other people and having a hard time talking to them, feeling very self-conscious in front of other people and worried about feeling humiliated, embarrassed, or rejected, or fearful of offending others, being very afraid that other people will judge them, worrying for days or weeks before a social event, staying away from places where there are other people, having a hard time making friends and keeping friends, blushing, sweating, or trembling around other people, and feeling nauseous or sick to your stomach when other people are around. Obsessive-compulsive disorder, OCD, is characterized by recurrent, unwanted thoughts or obsessions, and/or repetitive behaviors or compulsions. Repetitive behaviors such as hand washing, counting, checking, or cleaning are often performed with the hope of preventing obsessive thoughts or making them go away. Performing these so-called rituals, however, provides only temporary relief, and not performing them markedly increases anxiety. A person with a specific phobia experiences intense fear in response to an object or situation. For example, fear of blood or needles, fear of enclosed places, and fear of flying are common specific phobias, with fear of spiders, fear of snakes, and fear of heights being most common. To be considered a phobia, the fear must be out of proportion to the actual danger posed by the object or situation, and cause significant distress and impairment in functioning. Researchers are finding that genetic environmental factors, frequently in interaction with one another, are risk factors for many anxiety disorders. Specific factors include shyness or behavioral inhibition in childhood, having few economic resources, being divorced or widowed, exposure to stressful life events in childhood or adulthood, anxiety disorders in close biological relatives, and a parental history of mental disorders. Anxiety disorders are generally treated with psychotherapy, medication, or both. Psychotherapy or talk therapy can help people with anxiety disorders. To be effective, psychotherapy must be directed at the person's specific anxieties and tailored to his or her needs. A typical side effect of psychotherapy is temporary discomfort involved with thinking about confronting feared situations. To learn more about treatment options for anxiety, talk to your doctor or a mental health professional. Anyone experiencing severe or long-term anxiety can become overwhelmed. If you or a loved one is having thoughts of suicide, call the toll-free National Suicide Prevention Lifeline. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that can help people with anxiety disorders. It teaches different ways of thinking, behaving, and reacting to anxiety-producing and fearful situations. CBT can also help people learn and practice social skills, which is vital for treating social anxiety disorder. Computerized cognitive behavioral therapy, or CCBT, is based on the principles of cognitive behavioral therapy. These educational, interactive self-help modules can assist you in learning to identify your own patterns of thoughts, feelings, and behaviors. They're designed to help you understand how your thoughts shape how you feel and how they impact your life in significant ways. CCBT can be used along with face-to-face therapy or other types of treatment for anxiety. This program offers a number of different computerized cognitive behavioral therapy modules that may be helpful to you. In the next section, you may review the modules and select the one that you feel is the best fit for you. Each module includes 5 sessions that you will complete over a period of 1 month. Between sessions, you will have an assignment to work on each week. Remember, any new skills take time to develop. The time you spend is an investment in you and your quality of life.